All right, good morning. So today we're going to talk about the brain. So we've talked about bones for the last year. So now we're going to talk about some of the organs that are within our skeleton. So the brain has three different parts. Cerebrum is the main part on the top. Cerebellum is basically called the little brain. Looks like a piece of cauliflower, and then the brain stem, which goes down to our spinal cord. So again, cerebrum is the number one, cerebellum is number two. So big brain, little brain, and then the brain stem. So again, a small cauliflower and then like the stalk of the cauliflower or the peduncle. So let's take a quick pause and talk about radiation safety. So we can limit reducing exposure. We can limit the patient's exposure by appropriate beam limitation devices, like collimators, right? Or yeah, basically just collimators or mirrors. I use protective devices around the room like aprons or like the walls. We have primary barriers and secondary barriers, uh, leaded acrylic glass in the windows and portable lead glass that we can put in surgery suites or in front of patients like at Texas Children's. If patients want to be in the room with their kids, the kids can see them behind the leaded glass that we can kind of move around the room. The leaded glass has wheels on it. So we can limit the patient's exposure again by using body part immobilization. So if we have a kid on the table, we can put like towels around the patient so they don't fall off the table. We can immobilize the part by using tape if we're doing toes, or like tongue depressors if we need to isolate fingers or toes. Motion reduction techniques, again, we can use those same towels to hold the patient in place. Motion reduction could also be giving clear instructions, right? Stop breathing, taking a deep breath, hold it. We can limit the patient's exposure by filtering of the X-ray beam. So X-ray beams we can filter with the aluminum uh, that's in the tube housing. So the collimator has aluminum in there, so we can limit the low beams. So we want to keep the hard beams or the ones that are over 70 kVp, but the low beams only contribute to patient dose or scatter. Use gonadal shielding or like thyroid shielding when necessary. We can also limit the patient's exposure by appropriate digital imaging processing, like do we have to really repeat this image or can we just play with the region of interest, the ROI, and see if we can clear up the image that way. We can just try to eliminate repeat exposures by making sure we're feeling for landmarks, checking our centering, making sure, double checking one last time before we pull the trigger and look at our patient to see if we have light all around, if our field size is large enough to see what we need to see, and make sure that the field size isn't too large, our collimation isn't too open to where we lose our recorded detail. All right, so there is a 5-minute video that you can watch at your leisure, and it just basically talks about the temporal lobe. All right, so here again we have our slices. This is a coronal slice. Again, the cerebrum would be the big brain right up here on the very top. Their cerebellum is the baby brain, or it looks like cauliflower here at the bottom. So when we cut the patient this way, it's called a slice. We look at the different parts of the brain. So the cerebrum here is on the very top, separated here by the falx cerebri. So the falx cerebri is an important structure. It's like the lining or the split in between the two halves, the left and the right halves of the cerebrum. So this is the separator right here, the falx cerebri. So that's important to remember. So if you think of it, it's kind of like orange slices where you can kind of pull the different slices apart. So this is the lining or the membrane that splits them in between the two. The tentorium is the part that splits the top to the bottom. So the tentorium, which we'll talk about actually right here, tentorium cerebelli, splits the cerebrum from the cerebellum. So there is a falx in the cerebrum and there is a falx in the cerebellum, but we'll go over that one in a section, in another part. Again, cerebellum's here, cerebrum is up here, cerebellum is at the bottom, brain stem is right here. You kind of notice things look a little different here. So the bones actually look black in this image right over here. So brain is covered by meninges. So something you need to remember is there's three different layers. The dura mater, basically it's called dura, like durable is the tough mother. Mater means mother, so tough mother or outer layer. Arachnoid is the spider middle layer, and we talked a little bit about the subarachnoid space when we talked about myelograms. So here we have our pia mater. Pia is the soft mother or soft inner layer. So make sure you know the three layers, just like when we talked about the uterus has three layers. When we talked about the arteries has three layers, there's always an outer, a middle, and the inner. So again, we have a dural sinuses here, dura mater, that's underlined here in red, arachnoid mater. Again, subarachnoid space is usually where we might inject into, and then the pia mater as well. So dura's out, arachnoid's middle, pia's inside. So again, let's look at the separation. So in the cerebrum, the big brain, we have our falx cerebri that separates the left and right halves. Again, we have this part of the skull inside of the skull called the internal protuberance. So right at that junction, it's basically at the back of the skull. This is right over here, and that shows you where the superior sagittal sinus is. The tentorium cerebelli separates the cerebrum from the cerebellum here. Let's see here, what else? Inferior sagittal sinus. So there's the superior sagittal sinus on the top, inferior sagittal sinus, which is more towards the inside of the skull, inside the brain. So falx cerebri divides cerebrum into right and left hemispheres. Falx cerebelli divides the baby brain, the cerebellum, into right and left. The tentorium cerebelli divides the big brain cerebellum from the little brain, the cerebrum. So three different types of separation. So here we have a dura mater, which is the durable, the tough outer layer. We have our falx cerebri. Again, here we have our left and right markers pictured, patient in a supine position with an axial cut or axial slice. We can see the tentorium cerebelli, which separates the cerebrum from the cerebellum. Now we're going to start looking at, again, the arteries and the veins. Here we have our third ventricle. So in the ventricles, we have our cerebral spinal fluid. That's where all of this is located. Our lateral ventricles. So we're going to talk that we have at least four different ventricles. The lateral ventricle, the third ventricle, fourth ventricles. The lateral ventricles being like there's two, left and right. So we have our left frontal lobe here, right frontal lobe, and then again, yeah, so big brain and little brain. So ventricles, what are ventricles? Ventricles are the cavities in the brain that contain the CSF, the central spinal fluid. The choroid plexus cells produce the CSF from infiltration and secretion. They often calcify and they absorb IV contrast. So sometimes they may appear white because they calcify already. So important to remember, choroid plexuses produce the CSF. Again, as I mentioned in the previous slide, there are four ventricles. There is the right and left lateral ventricles, that's 1 and 2, the third ventricle, and then the fourth ventricle. Third ventricle is in the center of the skull, fourth ventricles pretty much near the brain stem. So going from the top to bottom, these are the ones at the top, middle, and the bottom. So here is a side view or lateral view of the ventricles and openings. So here we have our lateral ventricle here. These are all parts of the lateral ventricle. So we have the occipital horn, which is near the occipital bone, frontal horn, which is near the frontal bone. We have our third ventricle, which is right here in the center of the brain. We have our fourth ventricle, which is near the pons, which is part of the brain stem. And those are the ones that I really just want you to kind of focus on. There's a lot of terminology here, but the main ones are lateral ventricles, third ventricles, fourth ventricles, and know where they're located. So fourth ventricles in brainstem, third ventricles in the center of the skull, and then the lateral ventricles are up here on top. Again, the ventricles have the cerebral spinal fluid. Usually the choroid plexuses that produce the CSF are usually kind of located right around where the ventricles are, like right here. All right, so important slide to remember, this is a CAT scan of the lateral and third ventricles. So again, this is an axial cut. This would be your left side, this is your right side. The nose would be up here, the eyes would be here, back of the skull is here. So lateral ventricles, and it says anterior horn, so this is the front of the lateral ventricles. We have our thalamus in the center to give you kind of a landmark, and then our third ventricle is right here in the center as well. Septum pellucidum is just a septum is just a middle part, kind of like you have a nasal septum. Again, to me it kind of looks like a pumpkin, or like you have your eyes here, your nose, and a little smiley face right over here. So lateral ventricles to look like the eyes to me, and then you have your third ventricle, which is kind of like the nose. So flow of central spinal fluid around the brain, the CSF. We have different cisterns. Again, lots of terminology. Superior sagittal sinus here, and then it meets at the back of the brain. And then there's a inferior sagittal sinus, which we don't see, but it's important to see where the sinuses are and how the cerebral spinal fluid flows around through the brain. So it gives you little arrows here, and it kind of tells you the directions in which it comes in. So it comes up this way, goes around to the back of the skull, and kind of rotates and circulates through here. So again, cerebrum here, cerebellum here. Arachnoid space is right around here, right? Subarachnoid space. Choroid plexus. So these are the ones that produce the CSF. So this is the choroid plexus of the third ventricle. Choroid plexus. It's like this little spongy organ or whatever right over here. And then there's the ventricle in the front. So what we're seeing here is the flow of the central spinal fluid. Cisterna magna, so just a large cistern. Pontine cistern because so this is near the foramen magnum here. This one's near the pons right over here, which is part of the brain stem. And then the suprastellar cistern is here too. So again, just look at what I've kind of highlighted for you to remember or note. And then we'll talk about this structure here called like the corpus callosum in a little bit. Again, here before was just the illustration. Here is the actual image from the scan for the CSF and the cisterns. Again, what we're looking at here, third ventricle right here in the center. We have our aqueducts. Again, this is just where this cerebral spinal fluid is kind of flowing through. Again, cisterna magna is here near the foramen magnum. Right over here, pontine cistern. Cistern is just a collection area right over here next to the pons. Again, lateral ventricles here, third ventricles here, and fourth ventricle should be down over here. So fourth ventricle, third ventricle, lateral ventricles, and those are all four of the ventricles that we have. Okay, very important slide to remember. Should have had a star here, but just have to make sure you guys understand this. So internal carotid arteries. So they form an S shape. From here, I believe this is slide 13. So the next 7 slides have to do with the circulation of the blood flow throughout the brain. And this is important for strokes. So whenever we do imaging for CAT scans and mostly for MRIs as well, they talk about the circle of Willis. So the next 13 slides are regarding the circle of Willis, and that has to do with the circulation, the blood flow throughout the brain. So this is important because we're talking about strokes and bleeds. So if there's like a stroke, which has to do with like a blockage, then the doctor can kind of figure out which ways we can make alternate pathways. So if you're thinking about it like when you're driving down a highway, like let's say you're on 610 and then there's an accident and you need to take another route. So the GPS will take you maybe to like the Beltway or to like 59. So the Circle of Willis is basically that. So it's like the highway system that supplies the blood to the brain, to the scalp, and it goes to basically to different parts of the brain. So there's the frontal brain, the middle brain, and the posterior brains, and the face and the scalp, and all of those areas need the blood and the oxygen to flow through, and the Circle of Willis makes that happen. So the internal carotid is the beginning of that. It forms the S-shape carotid siphon, splits into middle and anterior cerebral arteries. The middle supplies the lateral parts of the brain. So the middle supplies the sides of the brain. The anterior supplies the frontal and middle brain, as you would guess. The communicating arteries is between the two anterior cerebral arteries. So the two cerebral arteries, again, supply the front of the brain, and then there's little communicating arteries that go between those two. So they're like little feeder roads. So we talked about the internal carotid arteries, and the external carotids supply blood to the face and scalp. So the internal ones go to the brain itself, and the external ones go to the face and the scalp. So two different sections right over here. Very important slide to remember. Okay, so what we just talked about, we can see our anterior cerebral arteries here. There's that S-shaped siphon, the carotid artery here, and then this is the middle cerebral artery that, so again, the middle cerebral arteries supply blood to the lateral parts of the brain. The anterior cerebral arteries go to the frontal part of the brain, and this is that S-shaped internal carotid that we mentioned in the prior slide. So here we have another clickable YouTube link that you should watch, and I believe this one's about 6 minutes. So let's talk about the vertebral arteries. These are the ones that are basically in the vertebra. So between the little holes on the sides of the transverse processes, there's little openings, and this is where the vertebral arteries come through. They supply the posterior parts of the brain. The right and left vertebral combine to form the basilar artery. This runs in the pontine cistern anterior to the pons. So it runs through the back and the vertebra, but then it runs towards the front of the pons in front of the brain stem. The basilar artery, which is part of the vertebral arteries, so remember that the right and left form the basal artery. Now the basal artery bifurcates, it splits into right and left posterior arteries. So the posterior arteries and the anterior arteries, those are the ones that form this circle of Willis. So Willis is the person who discovered these different pathways. So again, the left posterior and the right posteriors is formed from the basilar, which is formed from the vertebrals. So vertebrals to basilar to posterior. Now, between the large posterior arteries, there are little tiny small feeder ones called communicating arteries, the PCAs. The posterior communicating arteries, they join to form like the internal carotids as well. So again, here is our image with the contrast. Vertebral arteries here, forms the basal arteries, forms the posterior cerebral arteries that supply blood to the back of the skull. All right, so again, lots of terminology in this sagittal view or lateral view, but I already highlighted ones that you should kind of know. Again, there's our internal carotid artery that we spoke about earlier. The external carotid artery, so this one does to the face and the scalp. This one is for the brain itself. There's that siphon. If you look at that S in the front, so it looks like an S shape. So carotid siphons here. There's our anterior cerebral artery, which forms the circle of Willis. Middle cerebral artery, which supplies blood to the middle parts of the skull. our posterior cerebral artery, which supplies blood to the back of the skull. And the posterior cerebral artery, again, is part of the basilar artery. So the basilar artery forms into this. So it starts in the vertebral artery, goes up, goes along the front of the brain stem, and in front of the pons, becomes the basilar artery, and then becomes the posterior cerebral artery. So it's like one highway turns into another, turns into this. It's kind of like Bel Air turning into Holcomb Boulevard. Okay, so again, here is our axial slice of the skull and the brain. This would be our left side here. This would be our right side here. Again, important to remember this image. Here we have our middle cerebral arteries supplying blood to the lateral sides of the brain. Anterior cerebral arteries right here in the front. So here is our circle of Willis right over here. So posterior cerebral arteries are back over here. Our basilar artery is back over here. So again, the basilar artery kind of forms with the posterior cerebral arteries here. So vertebral arteries, basilar arteries, posterior cerebral arteries. Posterior cerebral arteries and the anterior cerebral arteries form the circle of Willis. Kind of almost looks like a shape of a man. We got like legs here, arms here, head over here. Basilar right over here, over like the butt. So the back of the man, the legs of the man, the arms of the leg, and the head of the man. So arteries of circle of Willis. Again, here we have our anterior cerebral arteries. Those are the main ones. We have these tiny feeder communicating arteries right over here. Middle cerebral arteries, again, middle cerebral does the sides of the brain. The anterior cerebral does the front of the brain. As we can see here, vertebral forms the basilar, forms the posterior cerebral. So you can kind of see the importance of like how this would be for strokes or for bleeds, especially for strokes. So there's a blockage somewhere, we can kind of see where we can reroute like the blood flows. So posterior communicating artery is right over here. So those are just the communicating ones, looks like, from the anterior and the posteriors. Internal carotid arteries is for the brain itself. Let's see, I don't see the external carotids here, but the external carotids would be for the face and the scalp. Cerebrum, again, that's the big brain, largest part of the brain. There's left and right hemispheres. Remember how that's separated by the falx, F-A-L-X. The gray matter is on the surface, white matter is the inner part. So the gray matter, this is the coronal section or frontal view, gray and white matter. So the white matter is, you can see on the inside. Thalamus here is in the center, and that would be like the third ventricle would be in this general area as well. Cerebral cortex is the gray matter that we can visually see when we're in surgery. Cerebral cortex, gray matter equals the basal ganglia. So what is that? It just receives sensory input, gives instructions to muscles. So that's what the cerebral cortex is for, the gray matter. Sensory input, instructions to muscles. Okay, so the white matter. Gray matter is on top, white matter is on the inside. White matter forms transmission pathways between hemispheres. So important structure here is the corpus callosum. So the white matter includes the corpus callosum. To me, it kind of looks like a mushroom, but we'll take a look at that in just a minute. So largest and most dense bundle of white matter. So connects the left and right cerebrums, forms roof of lateral ventricles. So lateral ventricles, again, is where the CSF is located. Connects the left and right cerebrums. It's basically the pathways between hemispheres. Remember, gray matters on the outside, white matters on the inside. Corpus callosum, most dense bundle of white matter. It's pathways. So here is our actual scan, corpus callosum. Basically, it's just nerve fibers. So we have our anterior commissures here, posterior commissures are over here, but the corpus callosum is this structure right over here. To me, it looks kind of like a mushroom in this case right over here. So these are all just different parts of the corpus callosum. So coronal view of the brain or frontal view. So again, lateral ventricles are here, left and rights. Corpus callosum is right over here. Remember, it's pathways, nerve fibers that connect the left and right halves. So this is in the white part of the brain. So the gray part is on the outside. The white part is here on the inside. Again, I have that underlined here for you. Again, we have our thalamus right here in the center. And so our third ventricle should be somewhere right around here. Pons would be our brainstem right over here, and this is where our fourth ventricle should be. A peduncle is just a fancy word for like the brain stalk. I wouldn't really worry about all these other things like the capsules or the nucleus or any of these for now. If you actually take a CT class, you will have to know all of these different structures. All right, so we talked about the cerebrum, the big brain. We talked about the cerebellum a little bit, the little brain. So now we're going down even further down to the brainstem or to the stalk. Consists of three different parts: the midbrain, the pons, and the medulla oblongata. So if anybody watched the Adam Sandler movie, it's a pretty old movie called Waterboy. There's one of the teachers in there, and he looks like Colonel Sanders, and they talk about how alligators don't have a medulla oblongata. So I'm sure you can find a clip on it on YouTube if you wanted. Well, basically, the brainstem basic functions for respiration, cardiovascular activity, consciousness, and complex motor activity. Okay, so midbrain, it's above the pons, many fiber tracts, has the stalk, or fancy word, the medical college word is peduncle, has a plate, inferior and superior plates. So the pons, the middle section of the brainstem, large oval shaped, projects anteriorly, relays signals between the spinal cord and cerebral cortices or cortex. Pons means bridge. Brainstem and pons. So here we have our pons, this shape right here. It looks kind of like an olive, but it's this shape right over here. And insula are just like the little indentations inside of the brain. Medulla oblongata. So extension of the pons. Has fiber tracts between brain and spinal cord. Has vital centers for internal activity for our body. So again, axial view of the medulla oblongata right over here. It says olive, but basically this is like the pons. And then remember, the medulla oblongata is just an extension of the pons for the brainstem. Here we have our fourth ventricle located in the brainstem area. Yeah, it says olive, but it basically kind of looks like an olive. I'm not sure if that's just a typo or not. So, cerebellum, baby brain, cauliflower appearance. It's the little brain. Vermis connects the two cerebellar parts, so the left and right cerebellar parts. Tonsils are the inferior portion of the cerebellum. All right, again, here is our lateral or sagittal view, cerebellum. So again, the parts of the brainstem include the superior portion, which is the midbrain. The pons is the middle section right over here. And then the medulla oblongata should be right over here. We have our cerebellar tonsils right over here. Again, fourth ventricle is here. The chord plexus should be right over here that produces the CSF. The tentorium cerebelli separates the cerebrum from the cerebellum, so the big brain, and the cerebellum, the small brain is separated by this lining right over here. Important image to remember, this is what an MRI of the brain looks like. And that is pretty much it for today's lecture. Great, thanks guys.